welcome to my presentation on sickle cell disease, implementation of early diagnosis, treatment, and prevention to improve morbidity and mortality. My name is Mohan, and I'm a rising sophomore at Palo Alto High School in California. I'm the vice president of the Women in Data Science Club at my school, and I'm also part of a club called Girls Who Code. I've been playing the flute since I was 8 years old, and I'm part of my school's instrumental music program. I'm also an advisor for the Teen Advisory Council at Kaiser Permanente. I volunteer at my local hospital, and my future plan is a career using science and technology to advance medicine. My agenda today will include a discussion about the global impact of sickle cell disease, its pathophysiology, and its worldwide incidence. I will also discuss how the complications of sickle cell disease are preventable and treatable. I will then discuss my research in this field. Sickle cell disease has a significant global impact. 300,000 babies are born with sickle cell disease annually. This number is predicted to increase to 400,000 by 2050. 90% of these children will die before their 5th birthday if untreated. And for those living with sickle cell disease, life expectancy is shortened by 20 years. Undiagnosed sickle cell disease is a contributor to excess child mortality worldwide. Sickle cell disease is caused by a point mutation in the beta-globin chain of hemoglobin and is inherited in an autosomal recessive manner. Affected hemoglobin polymerizes on deoxygenation, which then causes erythrocyte sickling. Vaso-occlusion causes episodes of sickle cell crises. The worldwide incidence of sickle cell disease is highest in sub-Saharan Africa, with hotspots in Africa, India, and the Middle East. Sickle cell disease affects approximately 100,000 individuals living in America annually. 90% of the world's sickle cell disease population is in Nigeria, India, and the Democratic Republic of Congo. In these countries, disease is 2% of the population, and trait is 10 to 30% of the population. 1,000 children are born with sickle cell disease every day in Africa. 66% of the 120 million individuals affected with sickle cell disease worldwide live in Africa. Up to 90% of affected children will die before their 5th birthday if undiagnosed and untreated. In one study, there was a 26% increase in deaths caused by sickle cell disease from the year 2000 to 2019 in the African region. The complications of sickle cell disease are preventable and treatable. Infections can be prevented by the use of vaccines and prophylactic antibiotics. Vision loss can be monitored by regular screening. Strokes can be prevented by early ultrasound screens. Blood transfusions can be given to reduce vaso-occlusive complications. Severe anemia can be prevented with folic acid supplementation. Pain crises can be managed with intravenous fluids and pain medication, and hydroxyurea can be used to prevent complications. Although screening may require specialized equipment, the interventions are easily available and affordable. But sickle cell disease must be diagnosed first. There is a high prevalence of sickle cell disease in Western Kenya. In this population, the incidence of sickle cell disease is 4.5% and trait is 18%. My research is being carried out at the Matibabu Hospital in Kenya, Africa, and involves creation of a sickle cell disease registry by screening newborns, children, and adults over a pilot period of 2 years. We hope to promote measurable approaches and interventions to help effectively screen, manage, and treat sickle cell disease in the region. My research objectives involve working with researchers, clinicians, and community leaders at the Matibabu Hospital in Kenya. This work involves creation of a registry to facilitate data collection, analysis, and dissemination. Early detection and management of sickle cell disease will allow for improved outcomes and reduced morbidity and mortality. Family testing and counseling will be provided to create a positive impact on the understanding and management of sickle cell disease. Psychosocial and nutritional support will be provided for improvement in quality of life and increased awareness for reduction of stigma. We aim to provide early diagnosis, intervention, and treatment of sickle cell disease in the region by creation of robust screening and management programs at the Matibabu Hospital. So in conclusion, sickle cell disease can cause a lifetime of crises marked by substantial pain, infections, anemia, and stroke. Sickle cell disease has a significant public health impact with numerous economic and social costs. People living with this condition experience significant impairment in education, employment, mental and social well-being, and development. Proven cost-effective interventions for prevention, early diagnosis, and management of this condition are available. However, many countries often lack the resources. In the United States, sickle cell disease is diagnosed at birth by universal newborn screening. However, this is not the case in several countries worldwide. Per Dr. Moetti, the WHO Regional Director for Africa, we need to shine the spotlight on sickle cell disease and help improve the quality of life of those living with it. With my research, I hope to contribute to this effort. The references used for this presentation are included here. I would like to thank the GHLC committee for the opportunity to present my work, my mentor, Dr. Schoenberg, a global health leader, and most importantly, Mr. Dan Agola, CEO of the Mati Babu Foundation, for supporting my initiative. Thank you very much.